giving every child the chance of life. In Laos, baby Musaya has a higher likelihood of staying healthy than any previous generation. Vaccines play a key role. It's estimated they save 2 to 3 million lives a year.
Bradford faces a grim situation. The peril of smallpox lies over the city.
50 years ago, things were different. Even in Britain, children faced many diseases that have all but disappeared. Smallpox was eradicated in 1980, showing vaccines can transform health.
In addition to saving lives, vaccines reduce illness and they prevent disability. And both illness and disability create a huge economic burden on the family, but also on governments, on the health system.
Let's look at the basic vaccines that every child should get. There are 11 of them, including measles and polio. TB isn't needed everywhere. Just 1 in 20 of the world's children is fully immunised, getting all the doses required, and most of them are in wealthier countries. Let's take some individual vaccines. Hib immunisation prevents meningitis and pneumonia, but fewer than 10 in 20, or half, are fully protected. For the vaccine which protects against diphtheria, tetanus and whooping cough, the figure's better, 16 in 20. But that still means around 20 million children every year don't get fully immunised. That failure has a human cost. There are 1.5 million deaths a year from these vaccine-preventable diseases. Nearly 2/3 are from 2 infections: pneumococcal disease, which causes pneumonia, and rotavirus, which causes diarrheal disease. The first vaccines against them were introduced less than a decade ago. Rich countries use them, and dozens of developing nations are beginning to. But there's a very long way to go. So what are the hurdles? Many health services in developing countries are so overstretched there aren't enough medical staff to carry out immunisation. Vaccines must be kept cold or they perish, and it can be difficult getting them to remote communities. So closing the immunisation gap between poor and wealthier nations remains a key target for improving children's health. Fergus Walsh, BBC News.